Onc Live Insights is a video editorial program produced by Onc Live.
When a patient is diagnosed with cancer, now we're all looking for personalized therapy choices for the particular patient. So knowing what the histology, knowing what the origin is important, so you know what test to order. If I had a patient sitting in front of me that has cancer of unknown primary site, that information doesn't tell me what sort of molecular tests I should order for that patient. If that patient's tumor was colon cancer, I would be ordering different type of tests focusing on RAS mutations. If the patient's tumor were to come from lung, then I would be ordering EGFR and ALK if this was adenocarcinoma or non-squamous histology. So knowing that information is critical to understand the molecular profile that you would order. And that's the reason why now we don't stop when a pathologist tells us that they can't give us more information. We pick up the phone, talk to them about, hey, this patient has, provide them with clinical information about the patient to see if that helps them make a diagnosis. And if you've done everything and you still don't have an answer, then I think using the CancerTYPE ID sort of approach is helpful, because this may help you narrow down the patient's tumor to where it started, and then you can do molecular profiling based on that. There are now some reports coming out that suggest that using that kind of an approach helps in better ability to detect molecular events.
The CancerTYPE ID, or the RT-PCR 96 gene molecular cancer classifier, is useful in making a diagnosis of the cancer type in patients with unknown or unclear diagnoses. This group of patients, traditionally, we have been had problems in making a precise diagnosis of the cancer type. Immunohistochemistry can help, but it falls short in about 60% of patients. Therefore, we need a molecular diagnosis in this group of patients to determine what type of cancer they have. With this, we can then apply specific treatment for that patient rather than empiric therapy. Site-specific treatment can, for many, improve their outcome. For instance, if a patient is diagnosed with breast cancer by the CancerTYPE ID or lung cancer, there are multiple treatments now available for those patients beyond the empiric treatment that is given when one uses shotgun therapy without knowledge of a precise cancer type. There are several sequential therapies that are useful that one would not know to use unless a specific or precise diagnosis of the cancer type were made. There are many instances where pathologists give a differential diagnosis for patients with unknown or unclear diagnoses of metastatic cancer. An example of this is in patients who have upper gastrointestinal tract cancers. There aren't real specific immunohistochemical markers for these cancers. Therefore, one is often given a differential diagnosis of 2 to 4 different cancer types. The CancerTYPE ID can frequently give a precise answer in that situation. There are other instances in lung cancer where one has a known lung cancer, but there's difficulty in determining if it's a squamous or non-squamous histology. In this particular setting, the CancerTYPE ID is frequently accurate in delineating squamous versus non-squamous histology. There are several other examples of unclear diagnoses or uncertain diagnoses. For example, in patients who had a previous cancer and now apparently have metastatic disease, is that metastasis from the previous cancer, or is that an unknown primary cancer from an occult primary? The CancerTYPE ID can often resolve this issue when immunostains fall short.
One additional piece of information to keep in mind about this particular CancerTYPE ID test is the minimal amount of tissue that's required to conduct the analysis. The analysis can be done in as little as 300 cells. That is very helpful, because in majority of the patients, by the time you do all these tests, you don't have a lot of tissue left, and you're left with the choice of either doing a rebiopsy, which has its own risks, or trying to make the maximal use of whatever is left. So I think having a tissue requirement that's as little as 300 cells is an advantage with this particular test, CancerTYPE ID.
The use of the CancerTYPE ID is effective because it requires very little biopsy material. Approximately 300 cancer cells is adequate to determine the cancer type and therefore have a successful test with the CancerTYPE ID. Usually one can receive these results in 5 to 7 days.